Now we'll look at another complication of hypertension. So when there's high blood pressures in the body, over time there's a complication in the eye, which we call retinopathy of the eye as a result of hypertension. So you just say hypertensive retinopathy. Okay, so let's quickly look at this. So hypertensive retinopathy, you say that it's actually a complication of long-standing or severe hypertension. So this one over time, the high blood pressures, the blood is flowing under a lot of pressure. So the blood vessels in the eye, they are very small. So if you put that pressure into them over time, it weakens them. You know. So the blood vessels are damaged, leading to vision problems and signaling systemic vascular injury. Do you understand? So for pathophysiology, um, chronic hypertension leads to what? Arteriosclerosis of retinal veins. So there's narrowing, there's thickening, you know. Acute severe hypertension could lead to vasospasm, leakage, and hemorrhage, cotton wool spots, and papilledema. Cotton wool spots, optic disc swelling, extensive hemorrhage, exudate surrounding the macula. These are all the definitive, you know, terms in how hypertension can affect the eye. So malignant hypertension usually leads to rapid vascular necrosis, optic disc swelling, and retinal ischemia. Okay. It's typically how it could look like. Okay, this is on fundoscopy. Okay, so complications: the person will not be seeing very well, be seeing blurry, and there's reduced acuity, and sometimes they could totally become blind. The retinal vascular occlusion, so there could be blockage of the retinal arteries because they are so small. Okay, macular edema, there's swelling of the central retina. Retinal detachment, there's exudative detachment due to leakage, and choroidopathy. Also optic neuropathy. Okay, then systemic risk markers is hypertensive retinopathy indicates increased risk of stroke, heart disease, and kidney damage. So that's what we have for here. So clinical signs, you see arteriolar narrowing and what? Tortuosity. Okay. Then arteriovenous nicking, copper and silver wiring of what? Arterioles, retinal hemorrhages, cotton wool spots, hard exudates, all those lipid deposits, you can find them there. Then papilledema in malignant hypertension. So diagnosis just have to do with dilated fundoscopy examination, retinal imaging, and blood pressure history. So we're trying to find out when it happened. It usually happens when the hypertension has been long standing. So management include you tackle the primary thing causing it, okay, which is hypertension. So your antihypertensive medication should be on. Then macular edema, you use the intravitreal therapy. Okay, retinal detachment, you have to surgically, intervene. So I think that's it. You also evaluate the other systems of the body to see that there's no complication in them. If there's complication, you also treat along